The NHS West Midlands Digital Health Service will provide health news, resources and tools to both NHS staff and the public through the internet. The daily experiences of you and your colleagues will be at the heart of the service. Best practice will be featured and shared.
Like we said, these cells are like locked doors. To open the door, we'd use a key, and that's exactly what insulin does.
You just pinch up a mound of flesh and go straight in. The needles are very sharp and they're lubricated.
Hardly feel it.
No.
See how others in your situation are getting to grips with new initiatives, like the introduction of care pathways.
A's advice, so we're focusing there on diet and exercise, not smoking, driving safely.
The service will help patients to understand what it's like to work in healthcare. We'll also be communicating your advice on prevention for them to act on. And you'll be able to rate colleagues' tips and ideas and suggest improvements. Your dedicated staff content can be accessed through the HealthWorks area, which will feature a broad range of topics for health professionals right across the region. Weight management and the innovative clinical approaches being made at Birmingham's Heartlands Hospital and community health centres is just one example of how we'll be bringing care pathways to life.
Exercise regimes, dietary advice and complex surgery are all part of the mix.
And within the West Midlands we have some of the highest levels of obesity in the UK.
I think if I run around the football field at the moment, I'd have to sit down for 2 hours.
Operations are not a fast fix. They should really be regarded as a last resort.
And new services provided by charities and voluntary organisations such as the Alzheimer's Society will be available. Their dementia advisors have recently begun work in Coventry. We'll be reporting on the differences they're making to the lives of people with dementia and their carers. Every day, the latest health news from where you live will be brought to your desktop by experienced journalists and medical experts. We'll capture the latest innovations in healthcare in the region and across the UK and show you how you can put them into practice. Continuous professional development resources will be available, convenient, relevant and accessible, at times that fit with your busy lives.
Have you had any nausea this afternoon?
No.
No? Lovely.
Did you establish, Paul, on what sort of pain level he had?
No, I didn't, sister.
So you might want to think about sort of how his pain is.
There's an expectation that every qualified nurse teaches.
I want them to enjoy the job as much as I do.
You'll be able to give your views about the quality of care that you and your colleagues are providing, learn from your peers and celebrate your successes. Easy-to-use tools will help you help patients, whether they want to find and choose local services or access health information or check out their symptoms. You and your patients can track the progress of people who are giving it a go, like colleagues who are quitting smoking, losing weight or taking on postgraduate training. And acting on your advice, we'll tailor some services specifically for NHS staff to be accessed via a personal login, including private professional discussion spaces. You'll also be able to access staff content through our partner network that will include intranets, social networks for different staff groups, and the resources provided by the professional bodies you're associated with. You will be able to shape the service yourself so that the information and materials that you want are on your computer or mobile, where you want it, when you need it, 24 hours a day.